Can everybody see? Yeah.
Yeah, that's great.
Okay. Hello, everyone. My name is Ekaelum Aninze, and this is my public health and social policy final presentation. I would like to start off with a territorial acknowledgement. I acknowledge and respect the Lekwungen people whose territory the university stands, and the Lekwungen and Wasanich peoples whose historical relationships the land continues to this day. A little bit about myself. Like I said earlier, my name is Ekaelum Aninze. I am a fourth year public health and social policy major with a main focus in disabilities. It has always been my dream to work with children with disabilities, so it was great to get hands-on experience during this practicum. I've also had the privilege to be involved with communities, both within university and outside university, supporting diverse groups. In future, I would like to go into health administration, and I believe it is important to understand the field from the grassroots level. This experience has given me valuable insights into what to expect in future. Before I talk about Bankadi, I'd first like to talk about my learning goals. These are the three goals that I set up for myself before I started my practicum, and I'm glad to say that I was able to achieve all of them. And I'll talk about that as I continue with the presentation. My first goal was to enhance my professional skill. My second goal was to develop my leadership skills. And my third goal was to have personal growth. Bankadi Community Services is a private organization. Although it is being funded by the Ministry of Children and Family Development, it is a private organization that supports homeless youth with behavioral issues, suicidality, drug addiction, and or special needs. The organization supports youth from as young as 1 to as old as 18 years old. Bankadi operates multiple homes across Greater Victoria, and their main goal is to provide a conducive environment for youth to grow, learn, and eventually transition into independent living. The organization implements harm reduction strategies and is committed to continuous growth. I had three main roles at Bankadi. Firstly, I conducted youth surveys. This means I went to each and every house at Bankadi and met with the youth to ask them questions about what they liked, didn't like, would like to change, and if they felt safe, loved, and supported. It was so great to hear that all of the youth love living here, although a lot of them are homesick and some others have some other concerns. For the most part, they love their living situation. Secondly, I updated fact sheets. A fact sheet is a document that contains a youth's personal information. Information such as their name, age, date of birth, social worker, etc. This document helps caregivers have a quick rundown of the youth's information. This is especially important when moving from home to home, so caregivers know what to expect. I updated the fact sheet with more questions to help caregivers have a deeper understanding of the youth, like their morning routine, nighttime routine, what are their triggers, and how to de escalate situations where they are triggered. I also added more questions, but I can't mention all of them right now. Lastly, I explored the idea of a third place. A third place is a space where youth, typically younger youth, can feel safe and supported. It is an inclusive community space where they can meet friends, play, relax, and also access community supports like counseling. A lot of the current third places we have in Victoria have a problem with the older youth influencing the younger youth. Bankadi would like to start working on that problem, and I'm glad to be a part of the beginning process. Additional roles which I had was I was assigned to a house called Firefly House. At Bankadi, all the houses are named about different things. So we have Amal, we have Chrysalis, we have Diamond, and so on and so forth. So I was at Firefly House, and I worked with two girls. One is a 13-year-old with autism, and the other is a 14-year-old with suicidality. And my responsibilities included assisting them daily with meals, with activities, with schoolwork, and just like being around them and being a support system. And it was really great to work with both youth because they're so different, but for the most part, they're just kids and they just want to be loved. So it was really great to meet them and connect with them. Challenges that I faced during my practicum were balancing work, school, my practicum duties, and navigating the complex processes within the Ministry of Children and Family Development. That is the social worker, legal guardian, foster parent, counselor, etc. There were just so many moving parts that I found hard to navigate. Secondly, another challenge was the cultural differences. I always make sure to implement cultural safety, but I can't lie, it's still a challenge that I am working on. Lastly, thinking on my feet during escalated situations. This practicum definitely improved my problem solving skills, but in the beginning, it was more challenging to maintain situations. PHSP values that guided me through my practicum were community-based approaches to research and knowledge development. This helped me prioritize youth voices in the development of the fact sheet and also exploring the idea of a third place. Secondly, diversity and cultural safety. Bankadi not only has a diverse number of youth we support, but they also have a diverse staff team. Integrating diversity and cultural safety has helped me to build stronger relationships with them and also ensure the unique needs of youth are being met. Thirdly, partnerships with people and populations served. This helped me with building trust and ensuring effective collaboration with my fellow staff. The call to action that aligns with my practicum is call to action 1. This is because it focuses on reducing the number of Indigenous children in care. Bangadi has a disproportionate number of Indigenous children compared to any other ethnic group. I will do my part to continue to integrate cultural safety and awareness in my practice, and later down the line, be involved in actually making a difference in reducing the number of Indigenous children in care. My advice for anyone wanting to go into this kind of work is to be patient, empathetic, and open-minded. Working with children who have faced trauma or disabilities can be challenging, but it's also incredibly rewarding. Take time to learn about trauma-informed care, and also don't be afraid to ask questions. Self-care is also important, so remember to take care of yourself because this work can be emotionally heavy. But most importantly, go into it with a genuine desire to help and learn because the impact you make, no matter how small, can mean a lot to the people you're supporting. Thank you so much. Any questions?